Hi everyone, my name is Josette and I'm presenting today on the country Niger as Assessment Task 1 for Comparative Health Systems, and I'll be presenting on how the country compares to in the framework of the World Health Organisation's building blocks. Those building blocks consist of 6 different areas: service delivery, the health workforce, health information systems, access to essential medicines, financing, and leadership and governance. So firstly, where is Niger? Niger is a country in West Africa. It's dominated by desert and it's landlocked. It has several countries around it, as you can see in the map. There's about 27 million people in Niger, and the majority of the country and the community practice Islam. Niger has some of the largest uranium reserves in the world, but its economy is mainly subsistence, cropping and livestock. It's also one of the poorest and least developed countries in the world. I'm just going to talk a bit about some key demographics of the population in Niger. The majority of the population is actually rural, so they live outside urban centres and cities, and over half the population is under 15, so they have a very young population. The life expectancy, due to a range of factors which we'll explore soon, is actually fairly low in Niger compared to countries like Australia, where the average life expectancy in Niger is only 60.4 years. I've also indicated here another key stat which is significantly different from a country like Australia, which is the neonatal mortality rate. So the proportion of newborns who die before reaching 28 days of age is significantly higher than a country such as Australia. So if we look at the epidemiology in Niger, the country has one of the highest fertility rates in the world, with women having an average of 7 children in their lifetime. But unfortunately, malnutrition, chronic undernourishment contribute to a very high infant mortality rate. So 50% in fact of the mortality rate of children under 5 is due to malaria as well. So malaria is endemic in Niger and several other countries in the globe. Severe drought and armed conflict continually impact health in Niger, as well as disease outbreaks. So how does this affect the health system? Well, Niger does have a goal to achieve universal health coverage, but unfortunately it has been assessed as sitting in the bottom 6 performing countries in sub-Saharan Africa. Though, as the graph above shows, the number of hospital beds has been increasing in Niger, the system itself still has a limited capacity to reach most of its citizens. Despite the majority of the population living in rural areas, only 24% of health services are located in these areas. So what this means is that about 61% of the population is more than an hour's walk from a health centre. We can also look at a range of other key data to look at health service coverage. This data comes from the World Health Organization World Health Observatory data, and it shows, for example, that the level of antenatal coverage, for example, only 38.5% of the population accessing the maternal population accessing 4 antenatal care visits, which is quite critical to supporting mum and bub leading up to birth. And also things which we'll look at a bit in further detail later, looking at that limited household capacity for households to spend privately on health. We're going to look a little bit at financing at the moment here, because obviously the amount that a country has to spend on its health system can really severely enhance or debilitate its capacity to provide universal healthcare coverage. And Niger is a country that has really consistently struggled to provide enough resources for health. If this graph above here shows our world in data, and it shows the total healthcare expenditure as a share of GDP, and you can see that over the last 20 years, Niger's has it's gone up and down, but it certainly hasn't gone above 6%, whereas Australia's there skyrocketing above 8%. In 2020, Niger spent approximately 151 million dollars on its healthcare functions. And even though the policy's been committed to provide universal healthcare coverage, as I was mentioned before, it's consistently compromised by insufficient funding. Niger also receives external aid, which is quite significant, and there's a strong strategic focus at the moment on aligning those different providers through a new mechanism called Providing for Health. A couple more graphs that I wanted to show to illustrate the fluctuation of the economy in Niger. Annual growth of GDP per capita between 1961 to 2021 shows that incredible fluctuation, which inhibits the country's ability to invest in health. And the graph on the right illustrates the significant contribution at some years to financing and sponsorship to address malaria at times when it was of key focus in the international community. So now we're going to talk a little bit about the health workforce. This graph shows how a comparison really between Niger and a country like Kenya, similar in sub-Saharan Africa, and developed nations such as the United States, Australia and France, where we can see the proportion or the number of nurses and midwives per 1,000 people is significantly higher than Niger. And I guess it sort of marries up with that the previous slides around that limitation in finance. Investment in governance, education, public health financing, architecture is known through the evidence base to improve universal access to healthcare in sub-Saharan states. So there's certainly a focus on that still. And foreign aid, for example, is used with a specific focus on training community health workers to be able to have conversations with the community on sensitive topics such as birth control, contraception, around really starting to work with the community around the birth rate. So how does the health information system plan and manage its resources? Well, there is a district health information system in Niger. It's been developed and continues to be enhanced with organisations such as UNICEF. However, it does still continue to be challenged. For example, the last National Demographic Health Survey could not be published in 2017 due to quality and health issues. And though births and deaths are required to be registered, no vital statistics are publicly published by the National Statistical Institute, which means that it's still very difficult to really be relying on the quality of those births and deaths and that data. Looking at medical products, vaccines and technology, a good thing I've seen in the literature is that the percentage of health facilities providing a full range of essential services which meet the national quality standards has actually risen in Niger from 50% in 2018, improving to 99% in 2021. But there's still a challenge for the country to be able to meet urgent needs for vaccinations, or if there's an outbreak such as measles. For example, in the COVID pandemic, only 10% of the targeted population were actually fully vaccinated against COVID-19. Another area which we can see limited availability is around contraceptive use, which has been found to be used by only 11% of married women. So it's estimated that up to 61% of women in sub-Saharan Africa have unmet contraceptive needs, of which Niger is a part. And we can see also in the literature that this really does stem to early in age, around access to health literacy and health supports, with only 30% of health services offering access to family planning for adolescents in 2017. This slide shows some data again from the World Health Observatory on Niger, and I wanted to use it to illustrate a couple of things. One is that when we look at, for example, the availability of vaccines, the MCV2, only 42% of Nigerian citizens have access to that vaccine at the right age, compared to over 90% in Australia. We can also see variation in access to sort of the infrastructure for health, the social determinants of health. So, for example, only 16.41% of the population use at least basic sanitation services, but even a further reduction to that is that only 8.12 actually are able to use those sanitation services safely, which again is that health literacy piece. Finally, looking at leadership and governance, Niger does have its own Ministry for Health responsible for the delivery of universal health coverage. The World Health Organization continues to support Niger to mature its health strategies, and it has established a National Institute of Medical Assistance to manage all aspects of the health system. But when we look at the building blocks overall, there are a lot of constraining factors which really first and foremost include that financial piece, which means that the country is not able potentially to invest enough in growing its health system infrastructure, ensuring there's enough health workers and that they are present and the systems are present in enough of the rural areas to provide that goal of universal health coverage in Niger. Thank you very much for listening to me today. Here's a full list of my references.